Prospective medical interns have criticized the National Education and Training for Health (NETH) Policy 2025, saying it was introduced without sufficient consultation and does not adequately address the welfare of health professions awaiting internship deployment. They say they are qualified doctors, pharmacists, nurses, midwives, and dental surgeons awaiting deployment and should be recognized as health professionals rather than students.
This policy seeks to extend medical training by an additional year while completely eliminating interns' allowances. Due to its severe flaws and a total disregard for intern welfare, the policy has faced immediate public backlash.
The policy also stated that only government-sponsored students should be given some part of allowance. And this suggestion is shambolic, it is very segregative, and therefore we call upon government not to take such a stand.
The interns are calling on the Ministries of Health and Education to review the policy in consultation with stakeholders and to implement the 2021 Presidential Directive on Intern Facilitation.
Ministries of Health and Education and Sports must formally withdraw the NETH policy, and we demand an open, time-bound, collaborative review process that actively engages all stakeholders. This includes training institutions, professional bodies such as UMA, Uganda Medical Association, PSU, AGNMU, UDA, FUMI.
They are also proposing an increase in the monthly internship allowance from shillings 1 million to 75% of the salary of a fully appointed officer, arguing that the current facilitation no longer reflects the cost of living or the responsibilities they undertake. The group further wants internship allowances paid monthly instead of quarterly, saying delayed payment exposes interns to financial hardship. They cite findings by the Federation for Uganda Medical Interns, FUMI, indicating that many interns rely on borrowing to meet basic living expenses during training.
Demand the immediate execution of the 2021 Presidential Directive regarding intern facilitation. Recognizing the severe rise in the cost of living and inflation since 2021, we request that the monthly allowance be adjusted to 75% of what the current medical officers get, which totals up to 4 million.
Based on the inflation, since then up to now, you all know most of the employees have been, their salaries or payment wages have been reassessed because of the inflation and high cost of living. We are not to be excluded. So we are actually asking for 75% of the presidential directive. However, it still stands and has never been withdrawn, but we have seen that was scrapped, something that needs to be investigated thoroughly.
The interns also want all eligible pre-interns deployed without exclusion, arguing that healthy facilities across the country continue to face staffing shortages.
We want full and timely deployment of all pre-interns currently. The Ministry of Health must deploy the entire current cohort of pre-interns without exclusion. With staffing levels in most public health facilities currently hovering at a critical low of about 30%, deploying all available pre-interns is essential to bridge the massive gap in healthcare delivery across the country.
The Federation for Uganda Medical Interns has warned that failure to address their concerns before the planned August deployment could affect internship deployment and potentially disrupt healthcare services.
A matter of urgency, because if it is ignored, we are standing firm on the decision that we are rejecting the policy, and we shall advise that no pre-intern or not deployed intern come August 2026 reports to the sites that they have been put, because this is a matter that is not only affecting the interns themselves, but also the people, the Ugandans that they are putting at risk.
In 2021, President Yoweri Museveni directed that medical interns receive 50% of the salary of fully appointed officers. The interns are now requesting that this be increased to 75%, saying the adjustment would better reflect current economic conditions. The Ministry of Health had not publicly responded to the latest demands by the time of this report. As the August deployment approaches, attention is now focused on whether government will engage the interns or review the issues they have raised.